Muscatine. We're coming a little late because we had a cool interview out at UnityPoint this morning that we'll have for you here in just a little bit with Cassie Bender for Breast Cancer Awareness Month. So you'll want to make sure you stick around for that. Quick programming note, we've got Muskie football this Friday, last game of the season as they try and make the playoffs. So you want to catch that Friday night, 7:15, all the normal places. And we're going to flip over into a more serious school topic, which is the election coming up. One quick thing before we talk with Kare Cooney, one of the candidates. Just a reminder that as part of the Discover Muscatine, Discover the Candidates coverage that we do, we give each candidate the same opportunity. We allow them, they each fill out a questionnaire for us to put online. We do a set interview where all the candidates get the same questions separately, and we'll put that all together for you so you can see their responses. And then we also give them a segment here on the Muscatine Today Show to be able to come and just talk a little more freely about the things that they feel are important. And so that's what Karen's doing with us today. And I also want to give one more caveat because I feel like this is important for people to know. Karen has known me since I was about this big, probably.
Yeah.
So if you notice that I probably have I don't want to say more friendly because I hope I'm normally friendly, but I've known Karen my entire life.
Yes.
And she went to school with my dad and
Yes.
mom, and so and there's several candidates that you'll notice that with too as well. So, but I just always like people to know that we've obviously known each other a long time, so that they don't think that we're in cahoots or something like that. But Karen, if you would, for those that don't know, introduce yourself, a little bit of background on what you've done throughout your career.
Oh, yeah. Again, Kare Cooney, and yes, I lived actually across the street from his dad, so that's how that connection ended up happening.
All the way back to when you were like kids, right?
Yeah, we were.
Because you were like next to my grandparents.
Yeah, absolutely. And anyway, so then through school, I actually had tough when I was first in school because I have a hearing impairment, and back then they didn't notice that, and I slurred my words and stuff because I said how I heard them. So they kind of put me in kind of like I don't want to say dumb area, but just didn't really, and they didn't have much back then in the line for special needs. And it wasn't until I was 10 years old that they finally figured out that, oh, she has a problem. And I'm totally deaf in my right ear, and I wear a hearing aid here in my left. And so without that, now I would not be able to have a conversation with you. And it's come a long way. It's come a long way because as I think of it as in and with my career, when I went to start working for the city through the housing department, a lot of the folks that I worked with, people automatically just thought it was people that just didn't work and things like that. But a lot of folks were disabled or elderly, or they had some kind of reason why their education just wasn't what they really could and needed to be. And that bothered me, and it kind of gave me that hook because I remembered how I was treated when I was younger, and stuff, and had to really, really work at making sure that my words came out right and everything. So it's kind of like, how are these other people handling it? How are people perceiving them? So I ended up being what's called a self-sufficiency program coordinator, and my job was trying to figure out what were those obstacles for those people to get jobs. And 9 times out of 10 is because of their education. So when I finally retired from this city, I decided I'm going to work for the school system. Well, of course, I couldn't just automatically be a teacher, so I thought sub. So I did the sub, and that was a fun but eye-opening experience in itself because I did it from grade school level on up to junior high level. Yeah, and I probably should have went high school rather than junior high in there, but no, seriously, it was really a good way to see what's all going on with the school system, and there is so much good stuff. Because in the grade school level, one of my first ones was special needs kids. And it was so interesting to see how that had to transpire. I had to literally take a truck into a classroom, and so that kid could see that truck, so he knew it was okay to follow me to the classroom, where then in a one-to-one setting, I would take and work with him, at a table and stuff. And then another one of the kids that I did the same thing with, on the way back to the class, all of a sudden had a meltdown in the middle of the hallway. And I'm like, okay, I don't think I was trained for that, what's supposed to go on? Well, one of the paras happened to be in the hallway and came over and just kind of scooped up the little one, and we was able to walk on to the rest of the area. And so to me, that was like, wow, okay, how that they, learn to do that. So then I knew that, again, since I couldn't be a teacher per se, other than that, the school board opened up, and I went, you know what? This is my way of making sure that I could make a difference on things.
Yeah. And so you've been on the school board now for 4 years. 4 years,
yeah.
And so, and we'll go through, when you see the other interview, it'll be some of the, like what are the strengths and weaknesses of the current school. So all that formal stuff's going to be there. So what I'd like to kind of talk about is some of the things that you see as important for the district coming up over the next, planning periods, short term, next year or two, longer, big picture. What are some of the things that when you think of the school district, are things that you're like, that's something we got to pay attention to?
Yeah, actually you said it in the right way, because there's always needs to be like that short-term style thing, but then we also have to look at at least a good 10-year span of time to be able to say what's going on and what are the needs with stuff. One of the areas is actually on the ballot this year is going to be, it's not a increase, it is the same amount as this 1% monies that come out on the tax area. It's not anything of an increase. What it is that by law, we just have to ask for it to go out for a longer period of time, with it. And
so basically, folks, it's keep sailing the same direction.
Yes. Yes, absolutely. Because see, all those kind of things and all those kind of monies is going to be very important, as we go on. And as I told you, like before we started, I always have material with me. My staff used to crack up at me when I would have things with a highlighter,
I actually do that quite a bit myself.
Yeah. And so I wanted to make sure that I brought a couple things just as a reminder what we have already done, which leads into what we're going to do. Okay. And one is, you'll remember, it was a good 4 years ago when we had a stakeholders.
Yep.
Stakeholders, and I know that you were a part of all that.
Yep. Yeah, there was this, they pulled in a whole bunch of people from the community, all different walks of life, parents, students,
teachers,
businesses, teachers, like whole 9 yards.
Yep.
And they did these big surveys and to kind of almost like a State of the Union sort of a thing.
Yeah, and it's like tell you what is good about your community and what are some of the issues, type of thing. And so it was actually quite interesting as I went through to see what kind of things, were on there. So you're looking at all of that took, and then at the same time, what else did we have? We had the curriculum audit. Look how big this book is.
I've seen that book, and that's just, I'll be honest, a lot of times, from the outside looking in, education seems like it should be easy. Yeah, you teach kids stuff. It's not. Like, I have so much respect for teachers and educators because I couldn't do it. Like, I'd like to think I could, but I know I couldn't.
Yeah, exactly. You may have, the education and the background and stuff, but at the same time, the actual, the love and what do I want to say it? Because the love of it is really, really important. Because we could go back to the fact that, unfortunately, right now, for example, the teachers union, they're not able to negotiate really with this because the state took away a lot of those bargaining rights. And so because of that, we still try to be able to see what we can do to give like the percentage amount that we can and stuff. But we also have to look at, okay, what monies end up getting to us. And for the general fund, that takes not only because of the teacher's salary, but there's a bunch of other type of components is all in that general fund that has to be used. So then it's like, what do you cut out and things like that. Well, then you go to, let's see, over here, we have the plans about enrollment trends.
Yep, and that's one thing that I think, just again, some quick background for folks before, because I have a feeling I know where you're going because we've talked before, but Muscatine, while our population has been static overall, enrollment at the school district has kind of steadily declined for about 10 years or so.
At least a good 10 years, yeah.
And not, it's population trending, it's, housing, it's sort of all that stuff boiled into one. But I think, Karen, could I borrow that real quick? Just to kind of give people
some. Look at that.
So you have
that shows you the difference.
Yeah, and again, Chris, I don't know which camera you want me to point at mine. Just kind of a quick thing, this was 13, 14, 5,200, and we're down to 4,500 kids for 21, 22.
About 700.
About 700, which, when you're talking about that's how the district is compensated from the state, it makes a big difference in budgets.
Yeah, because then you have to go from there, and that brings us to partially what the school board is about, because we're the business part of it. We're the ones that govern from that aspect of it and making sure all this works. The superintendent's job is to, from the day-to-day area of an immense, over 700 employees and 4,800, students style of thing. So when you go through all of this and you come at the very end of here, we start going, okay, how many students are you supposed to have per class? How many are you got with that declining enrollment? Because we actually look at the birth rate, and then we can kind of see from there and everything. And then you start looking at the ages of the buildings. And our buildings, I think I call it the baby of the buildings is about 50 years old now.
Well, because, I'm trying to think, and I know I've talked about this with folks before, Colorado, which is now the Early Learning Center in Mulberry, were built basically the same time, same building, because that's where my son goes, and you can walk down and it feels the same as when I was a kid at Colorado. Those are, I don't want to say some of the newer buildings, but obviously the high school was 70s. Yeah, because that was 75, I think it was.
75, I believe, because my little brother was able to graduate from there.
Yeah, and then my mom did. So facilities are a huge thing, and
it is.
I know there's obviously also conversations about what's done with old buildings, and I know that was one thing you wanted to talk about real quick.
Yeah. Because, for example, usually the life of a building is considered, in Mayor speak, about 70 years. And we are at that, at least, on a good portion of our buildings. And that's why we had to kind of go around and figure, okay, which ones are the best suited to do what we need to do in them to give them some more life, for a while. And so then, the discussion happened, 4 years ago, started about what was all going on with Central and West, and then trying to get everybody over there. And then, of course, that all started happening when the pandemic happened. And so that was, it was very difficult, for everybody, on there. But when they looked at those buildings, West was the best building area to be able to do compared to Central, because Central's building, I can't even tell you to go through, the listing of all the stuff that was wrong with that building that was not worthy to be.
Here's the one thing that I tell people. I went to Central as a middle schooler back in, let's call it early 90s.
Right.
And it wasn't great then.
Yeah.
No air conditioning. It wasn't.
Yeah.
I'm not really complaining here, but
right.
That was a generation ago, and I didn't have it wasn't like a comfy experience.
Well, was that building, and I'm going to get it probably wrong. I want to say 1939. I may be off. But anyway, that building was the high school for me.
Right.
Area of it. And that high school was built. My Central Junior High is now torn down in the elderly high rise. So when you think of the how we look at it from the back standpoint, we're now used to the fact where all these, places have gone and stuff with it. So we have to think about the future as in which ones are best to work. So with the central building, and this is where then, we all know then controversy come in a lot of ways as in what's happening or not happening, and everybody thinking that we're going to tear down everything, on there. And that was actually one of the other reasons I wanted to be on the school board. Because why? Because there's that theater there. And I'm a theater rat.
A little bit.
Just a little bit, yeah.
Yeah, a little bit.
I've been at it for quite a long period of time, and so I know a lot of the and ifs and buts about that whole building there, as well as I've got some really good folks that want to work with me and with the administration to be able to come up with what's the best way to really get that back up to what it needs to be. So what that means is the theater is going to stay and the gym back behind.
Which is actually really kind of cool, because those, gym space is huge. We know we need more of that.
Yeah.
And obviously we need a great performing arts center. But what's cool is and I saw a really small thing on this, but basically they can take that wall on the outside of the hallway, and that can now become the outside of the building, and they can basically kind of like cleave it off. Yeah. And you can keep those two big components. But then get rid of the part that's mostly the cancer side. Yeah. So,
and that's a good, kind of a choice of words with it. I mean, as it is, there's a conservative amount of what they're thinking that's going to cost just to get that back up to play, because the HVAC system and everything else, because the boiler system and everything else that was in that building, that needs done. And yes, because you're absolutely right with the needing that gym. Yeah, we need that desperately for not only just all their basketball things, but many other type of things we use.
I was talking to some people about like facility space. You could probably add 4 full-size gyms. So two more of the Van Heck Center, 3 of the big gym at the high school in this community, and still not fully serve all the stuff that goes on.
Yes, and that pays tribute to how well our sports program and everything has gone with that. And so that's also why, from the theater side of things, the art side of things, because you're talking band, orchestra, and the theater and other things you can have, we could bring, we're not an Adler theater quite, or Circuit 21, but if we do this the right way, and I'm loving the idea of this, if we could do this the right way, we could really bring in some good acts and different things there. And we'll have better parking too. Why? Because that spot where the building was, that's going to generate a lot more parking and then kind of round. Because as it is, the teachers, that have that spot over there by Jefferson.
It's not a lot.
There's still parking all along Mulberry.
So facilities are going to be big. What are some of the other things that you are excited about when you see, when you talk to somebody about like why you want to be on school board again? What are the things coming up that you go, you know what, that's something I want to be a part of, or that's something that's going to be cool?
Yeah. Again, one of the things is with the theater area, but the other part of it is because I think there's two more things I guess I would feel most comfortable with saying about. And one is more that we can do to help our kids and our teachers and everybody is. And it's on one hand, I'm excited about what we can do, but on the other hand, it's a hard subject, and that is bullying. And I know a lot of people have a hard time of how they want to be able to talk about that, but it really has to do with what we invest in the mental health. And the mental health of both our teachers and our students, so that they know how to be able to handle it. And when I say that, even with the student standpoint, bullying.
Bullying.
Yeah,
I thought you said bowling at first, and I'm like, Aaron, where are you going? I'm like, no, but no, yes, and absolutely, yes. Bullying is, yes.
Yeah, because, and if you think about it, one of the areas that gets lost in it, and this is sometimes where it gets a little controversial, is area that gets lost with that is how about the bullies themselves? Because why are they doing it? Is it something from at home? Maybe they were bullied, any number of things. So what can we do to make sure they don't keep at it?
Yep.
You know, and we don't want the person that's being bullied to carry that all their life, and then by the time they're adults, and then we got two sets of people that are not very productive adults then.
Right.
You know, so we want to help that, and I want to be a part of what needs to happen with that, the mental health area.
And that's one of the things that I think teachers do a tremendous job of as a blanket statement overall, is balancing like social growth with academic growth with, and I'm sure you guys have multiple lanes and ways to describe all this that I don't have the words to describe, but you know, it's the barriers for people to become the best them aren't always just learning 2 times 2, right?
Yeah.
And teachers on the ground, by and large, do a tremendous job of recognizing what it is each kid needs. You know, because you know, a lot of the stuff that you guys put out talks about, like, I don't remember exactly how Tony always words this, so I apologize. But like, you know, success for every kid. You know, what does
Portrait
success
of
for
a
every
graduate.
yes,
Yeah.
which leads into the portrait of the
Yeah.
graduate stuff. But like, what is the next thing that each kid needs? And that's something, you know, it's like almost like customized education in a weird sort of way. And that's something that I've been really proud of what the district does.
And it's funny you should say on some of that is because, for example, people say, well, you don't even teach cursive writing anymore in school. Technically, we don't. We do, as in the kids get help with it, you know, so to speak, and they write certain things with it. But as I was told, it says, well, think about it. In the age of technology and everything that we have now, and what the school has time to do with, they're doing the, you know, that way. And so that's part of that area, the partnership with the parents to have that help and wisdom to be able to do there.
It's funny that you mentioned it that way because, you know, we have some friends that are like occupational therapists and stuff. Like cursive does a lot of good things. Yeah. And so I'm like, okay, cool. But you know, Wyatt's 11, 6th grade. He's a tech kid. I'm a techie. He's been a techie forever, right? At the moment, if you had to choose, as a parent, if I had to choose, he can write cursive or he can be extremely fluent in all things tech, I'm going to choose all things tech. But the other thing with school is, he was introduced to it at school. I don't remember which grade, which class, whatever, but he wanted to learn how to sign his name and do some cursive. So he does it at home once in a while. Like we don't like put, but like every once in a while he'll just he'll start working on it. We'll work with him, and you know he can, you know, and so he's still getting some of those advantages while still being able to have that tech education. That
well, this brings back to, and to see how complicated what schools are, and as a business and everything, how complicated things can be. Because again, this is that curriculum audit. That curriculum audit tells all the different areas that was observed as in doing really good at things and what we needed to, you know, up on and everything. And part of that is things that for the school board to do. The other big part of it is what the teachers and administration should be able to do. So when you're looking at, as in, okay, the state's telling us we have this credit, this credit, this credit that we need to make sure the kids do at. Now, you guys need to figure out which ones are the most important of, you know, English in the area of English, what you're going to teach them, in the math, what you're going to teach them, and stuff like that. That becomes very expertise and mind-boggling in a way, as in how much that you're teaching, you know, on there. And parents sometimes need to understand, you know, that is a very much a specialty. You know, and that they should be able to trust the teachers, that they know what they're doing with that. But it's a partnership, so that they can talk about if there's a problem with it.
And you know, we'll actually talk about this a little bit with the Wellness Wednesday segment coming up that Cassie and I talked about. It's always about those first steps. It's about having positive communication with the people that you're working with, whether it's healthcare, education, whatever it is. You know, it's always easiest to think that the person opposite of you, if you have a disagreement, is doing something horrible or bad, or they're doing it with intent. There's very, very rarely is anybody doing anything with intent. You know, I mean, it may not be what you want, or it may not be whatever it is. And I think that communication and grace goes a long way in having a positive experience.
Very true. And the easy example I can give is I had a conversation with a father about something that had happened with his child. And he was saying, well, basically what I got from the conversation is the teacher told him to get over it. And, you know, I had to think about that from when I looked at him. I says, do you really think that the teacher actually said those words? Because I says, I have a problem thinking that the teacher would say that. And he had to think for a moment and then realize that he was really paraphrasing what he thought he heard from it.
Yep.
You know, not as in that teacher said that there's a lot more words from there, and then the narrow part of, because why? He was emotional at the time of when it happened. And then you don't get it.
And I'm sure that goes both ways. I'm sure there's times parents are, you know, upset and a teacher hears what they said and they happen to focus on one little part that they heard. And we all know this happens. It's anybody that's in the communication business at all knows it happens all the time.
Oh, yeah.
And it's all really a big form of miscommunication, right? Not intentional, not whatever, but if you can learn to be aware of it, it can make your life much, much better.
Well, that's why I actually, on my campaign sign, I actually have in the middle of an apple, I put words matter. And that's why I wanted to make sure that was there, because what you say matter, because somebody may interpret it different, you know, because I know what I'm saying to you, you know, on there, but are you really hearing, you know, what I've said on there? So sometimes it's that say it back or whatever, so you make sure that
reflect the message. We all
all of that.
So okay, so we've covered most of the serious stuff.
Right.
I'm going to put you on the spot.
Okay.
You didn't know, so we have a rule that they can't bring up my childhood or anything like that. But I'm going to put you on the spot for the current school board. Okay, so there's what, 6 more of you?
7 of us.
7 total. Yeah. Who's the funniest?
Well, who used to be the funniest, who is no longer on, because at the end of the meeting when we would say, you know, about closing, you know, he'd always say nay, you know, and it's like,
who did that?
Yeah,
how did I miss that?
Who did pardon me? Oh, Toby, yeah.
Oh, yeah, no, I did actually, I didn't know Toby did that.
Yeah. And so I'm just waiting for somebody else, you know, in which to do that. But I would probably actually say, I would have to say Mike Morgan. And bless his heart, he chose not to be able to run again. He just sometimes, he just lightens up when he goes to talk, because he gets so, you know, about what he wants to talk about. So then it's usually I sit back, and so it's kind of like, and then just be able to listen to what he has to say. But it's always fun. It's always fun.
And I think that's one thing to remember, whether it's school board, city council, board of supervisors, whatever it is, you're all just a bunch of people at the end of the day.
Yes.
And I don't think, regardless of all, I mean, obviously Muscatine's had its issues with councils and boards and things in the past, but again, at the end of the day, it's all still people who are, generally speaking, waking up, trying to do what they think is right.
Absolutely.
And just listen, and I think this board has done a really good job of that.
Thank you, I appreciate that.
I would commend the last cycles board, you know, and that's always a good thing. It shows that things are well run. It shows that, you know, and you guys went through some tough stuff.
Well, and you know, because being a nonpartisan position, and with that, we do it because of our love of what we do, because we don't get paid for, you know, doing it or anything, you know, with it. But each one of us, I thought about that one day, because somebody said that they've watched a meeting and they kind of say like, well, this person does this, and this, and it's like, oh yeah, it's so true, you know, and how we act, react. But the thing I mean by that is everybody on the school board asks good questions. You know, sometimes that sounds a little strange when I say that, because we ask questions that we may actually know some of the answer on, but the intent is make sure the audience, make sure everybody else knows on, because they're not there in which to be able to do, since this is our meeting time, we're making sure on that. So there's some really good questions that are asked.
Okay, one last thing.
Okay, what?
Show us your ring.
Oh, yep.
She wore it on purpose.
Yep, my high school classroom, my high school ring, we just had our 50th, oh my gosh, I can't believe this, 50th class reunion just about 3 weeks ago, and I was the MC for that, by the way. And I asked how many people are still living in Muscatine, and you would really be surprised how many were still in Muscatine.
There's a lot.
And that was a lot fun.
I'll bet you I don't go a week without running into somebody from this class of 73. I ran into one at the hospital this morning. Yeah. You know, that knew Dad, and because my dad was in their class. Yeah. And I'll bet it's at least once a week, because you guys are everywhere.
I can still get this on now. I can't get on my little pom-pom outfit that I had back
Okay,
then,
on
you
that
know,
note,
anything like
everybody,
that,
on
but,
that
you know.
note, Karen's gone off the rails. No, Karen, thank you for coming in.
Oh, yes.
Really appreciate it. Fun as always. Thank you for running and serving,
Yeah.
and good luck.
Thank you,
And
appreciate it.
we will be right back after the break with Wellness Wednesday with Cassie Bender from UnityPoint Trinity Muscatine.
We are looking for a zero-turn lawnmower.
At Hustler Turf, quality matters,
Can I test drive that one?
In the store?
even in the buying experience. We know you want to buy from someone who knows what they're talking
We're
about.
looking for a zero-turn mower.
Like
Great.
this guy.
First thing you need to know is what's the size of your property? Are there any obstacles?
Head to your local Hustler dealer and talk to a lawnmower expert.
Stop in to Muscatine Lawn and Power at 2020 Stewart Road to see Hustler quality for yourself.
We've all been through a lot together, and along the way, you'll find out who really cares for you and who you can.
And welcome back. We are out at UnityPoint for Wellness Wednesday. And this is a really special Wellness Wednesday because obviously this is Breast Cancer Awareness Month. And so we're here with Cassie Bender, the Cancer Care Coordinator for UnityPoint, to talk about all things breast cancer, essentially, right? And, you know, the stats are really kind of crazy. 1 in 8 women will be affected. And, you know, it's always weird when I do interviews like this, I'll be honest, because, you know, obviously I'm not a woman. However, I have some pretty significant women in my life, right? And so, you know, guys, pay attention because this is something that is obviously extremely serious, manageable in the right circumstances. But, you know, they always say empathy is being able to put yourself in somebody else's shoes. So this is the time to tune in and make sure you at least have an idea of what they're going through, so that you can be a decent level of support. Sound about right?
Sounds right to me.
Okay, so Cassie, if you would, introduce yourself and a little bit of what you do here at UnityPoint.
So my name is Cassie Bender, and I'm the breast care coordinator. So I help navigate breast cancer patients through their journey from diagnosis through survivorship and also in the high-risk program.
Gotcha. So obviously screening is important. And so walk me through real quick, because I'm going to guess most of the women probably have a good idea about this, but what is like the basic screening process? Like, I know mammograms are involved. Like, when do you start? Like, what does that preventative piece look like?
Yeah, that's a good question. So a lot of ladies don't know that we actually want to do a high-risk assessment or a risk assessment for your breast health starting at age 25.
Oh.
Because your risk is very individualized based on your personal and family history. So in some instances, we may want to do screening a little bit sooner or add additional screening methods into your prevention and detection program. Most ladies at average risk, though, will start screening mammograms at age 40.
Gotcha. So, and I know that was something that, because of my wife's family, and I know she's okay with me saying this, but like, because of their family history, she did start really young. I don't know if it was quite 25, but I know it was definitely on her radar really early, and, you know, it's been a positive thing because across their family, they've all been way more aware. So,
Right.
So what should a woman expect, like, when you start that process? So, like, the screening process, the mammograms, what is that all entail?
So it's going to depend on your individual risk and what the recommendations are. As far as a mammogram goes, which is the most typical screening that women start at age 40, as you know, you will be in the imaging department for about 30 minutes. Some ladies will say it's a little bit uncomfortable, but usually not described as painful. But thankfully, the compression for the mammogram is only about 5 to 30 seconds, so pretty minimal stuff.
Gotcha. And if you want a slightly humorous take on this, my wife actually, not knowing that I was going to be talking about this today, last night sent me a TikTok, and we'll put a little note out there later if you want to. But a young man is doing a little breast cancer awareness kind of video, and he's describing what it's like. And I think his words were essentially a boob metal sandwich that's cold, something to that effect. Go look at it. It's a humorous take on a really serious topic, but if it helps get you a better visualization, go check it out. But
It was pretty funny.
it's funny. I mean, and you know, that's a tough thing with when you have really serious topics like breast cancer. You can't not laugh about some things that happen in life, right? And you've got to have a positive attitude. My dad had pancreatic cancer, and the one thing that he would tell you is, you know, he would always joke, I don't have a date stamped on the bottom of my foot, and you know, like all this other stuff. And the positive attitude and the humor, I personally believe, kept him around for 5 years with pancreatic cancer,
Yeah.
which is huge. So, you know, please don't anybody take if you know, as we joke slightly about this, don't take that as like it's not a serious topic, because of course it is. So do you have any tips for women as they get ready for this, like either for the procedure itself or like how to schedule it?
Sure, yeah. So as far as getting ready for your mammogram, so important things to remember is you don't want to put on any lotions, deodorants, powders, sprays the day of your mammogram. Also, if you're looking to decrease the discomfort, if you have any, you can decrease your caffeine intake prior to the mammogram. That can actually make the breasts more sensitive.
Really?
Yes, really.
I would have, okay, see, learning.
Learning. It's important to know your vaccination history. That can affect or kind of sway what the images look like sometimes. That came about mostly with the COVID vaccination,
Oh, okay.
where we became aware of that. So that's good information to have as well.
So now the mammogram obviously is the medical procedure side of it.
Yes.
But there are like self-checks that they
Yes.
should be performing
Yeah.
at home, right?
Of course.
And what does a self-check look like? How often should they do it? What are they looking for?
Once a month, about the same time of every month would be important. They would be looking for changes for like lumps and bumps, skin changes. That's the most important things to be.
That's like the small
aware of.
circular, like,
Yes.
okay, see,
Yes,
I
you've
I
got
do
it.
pay attention, right? Like, no, you know, so it's like small circular motions, like methodically
Yes.
throughout the breast to
Yes.
kind of like, almost, it looks like, I could be totally wrong, almost like massaging through the entire breast
Right.
to find if you feel like a little bump, nodule,
Yes.
something. and then-
Anything different.
Yeah.
Anything different. That's why it's important to know you're normal,
Mm-hmm.
because then you're absolutely going to know what's different for you, and you can report it to your provider, hopefully to be detecting any issues earlier than you would have. Another thing I'll tell you about the self-breast exam would be it's important to get all the tissue of your breast. It goes from your breastbone here all the way out to your armpit, the breast
Right,
tissue
yep,
does.
yep.
And it's also helpful if you use different levels of pressure when you're doing that exam. So like light, medium, and then deep pressure to be able to detect lumps at different areas in the breast.
Gotcha.
Yeah.
So when you guys talk about wow, that was a really bad colloquialism. I apologize. When you're feeling for that, when you say somebody's going to feel what would become like a small thing, how big is a small thing? Is it like a BB size?
The
Is
size
it
of a pea, I
pea?
would say,
Okay.
is probably what you're able to feel on exam.
Gotcha.
Yeah.
So I mean that's noticeable. I mean it's not. I mean I would think. I mean, obviously I've never done one, but I would think a pea you would notice as
Yeah.
you were doing that.
Like a frozen pea.
Gotcha.
Yeah.
Sorry. Okay. Scheduling your mammograms. We didn't really talk about that as we dove around. So, do you call general provider?
Yes.
Do you have? You
Yes.
could use MyChart, I would imagine.
You can schedule on MyChart now, but what you want to start with is your primary care doctor or your women's health provider. Those are the two physicians that primarily order screening mammograms. And then you can call scheduling to get that all set up for your appointment. And if you have any concerns about insurance or financial obligation, you can ask the scheduling department. And if you need additional resources, they'll get you there at that time.
Awesome.
Yeah.
So now we sort of know the prevention model, or like the screening side of it. What are some things that women can do to help prevent it? Like as far as like lifestyle, nutrition, what are some of the like key things that you would toss out first?
So I would say just maintaining a healthy lifestyle, like you said, getting enough exercise and the recommended amount of sleep. Avoiding smoking is helpful in avoiding any kind of cancer. And then just a well-balanced diet.
So basically, like all the stuff we're supposed to be doing anyway?
Yes, correct.
Got it. And,
Yeah.
and I think, it's funny at this point, I think we all know what we're supposed to be doing.
We do.
Whether we do it or not is always another question.
Yep.
But, so say the unfortunate happens and something's detected. What does UnityPoint offer, and as far as like treatment, what does that, because you kind of then switch into a different gear, obviously,
Yeah.
right? So what should someone expect when you switch into that treatment gear, and how are you guys like geared to support them?
That's a good question. So thankfully, here locally at UnityPoint, we do have comprehensive cancer services all right here in our community. We also have, not just for cancer, but we have a high-risk breast program that offers screening, genetic testing, and counseling services, and then navigation services from myself and my partner Jamie as well for the cancer patients as well as the high-risk patients.
Gotcha. So you guys basically kind of act like a traffic cop.
Yeah, that's a good analogy.
So we had, our daughter had a rare genetic disorder, and so we were at the university a lot, and we had care coordinators up there,
Okay.
and sometimes we did it ourselves, but it's always great to have somebody inside a medical organization that sort of knows the ins and outs, to be like, oh, hey, you could do this too, or let's try this, or you know what I mean? And sometimes it's even nice to just have an extra ear to like, hey, here's where I'm at. I'm not sure what to do next. You can listen for a moment. You can help ease any anxieties, not that you're, I don't want to say that's like your whole, but you can like help them understand what they're going through and where to go next.
I think you're spot on there. That's actually my most favorite part of my job is being a sense of comfort in the way of education and being a resource and a listening ear during the most difficult time of a lady's life.
Yeah, and that's, the one thing that you find, most people, and this is not just in like the medical field, but most people are fearful of the things they don't understand, right?
Yes.
Information more often than not leads to comfort. Even in a bad situation, if you feel like you understand what's going on, you can at least be at ease with it, or maybe not at ease, but you can process it and manage it better.
Yeah.
And there's always, what I always talked about was the translation between physician and patient, right? The nurses do a great job of this. You guys in your positions do, where, sometimes you're with a physician and provider and there's a lot of medical jargon that comes out, a lot of whatever, and you don't always catch, because they always ask, do you have any questions? And you kind of sit there and go, no, right? Because at the moment, you can't think of any. But then as soon as you walk out the door, you're like, oh, wait, I should have asked this or that, or I didn't know what to ask. And folks in your role are critical in picking up those pieces and closing those loops for people.
Yes.
And there's no way to truly estimate the value of your positions like that. So if you are in that situation, absolutely take advantage of care coordination.
Thank
Sorry,
you.
little PSA there. Sorry, that was not scripted. That was not planned. That was just me being me. Sorry. The people watching at home are used to me doing this, so
Okay.
it's totally normal. So I think, is there anything else that you wish a woman would know that they might not? Because we've covered all the basics, right? You know how to get here. We know how to screen. We know how to do all those things. But I'm going to guess there's one thing that you're like, oh, I wish everybody knew this. What do you think it would be?
I think one piece of information that I think is really helpful in ladies that might be scared or nervous about taking care of a lump or something that they've found, or being nervous about their mammogram. I think the comfort in knowing that early detection can make such a difference in their treatment plan and their outcomes and their survival rate. So don't be afraid to take that first step and talk to your doctor.
Oh, I'd swear you've watched every interview we've done out here, because that's
I
one
never
thing.
have.
That's one thing that we talk about often is that first step. It's always the hardest.
It is.
It's does this apply to me? Does it not? Should I call? I'm nervous about calling. I'm anxious about calling. I don't want to get bad news. You know, there's 100 things you can self-talk yourself with into not making that call. And every single provider, go back, seriously folks, go back, watch every interview that we've done here from any healthcare provider, and they all say early detection matters. It doesn't matter whether it's varicose veins or heart disease, early detection matters. So if you're sitting at home watching right now and you're even remotely thinking this may apply to you, it probably does.
Right.
And just pick up the phone. There are people trained to be empathetic and understand exactly where you are on the other end of the phone.
Yeah.
So.
Or get you where you need to be
Or-
if you're not
right.
sure where to start.
Yeah, exactly. That's what I mean. They know where you need to go. They understand where you're coming from, and I say this not tritely, is chances are you're probably not the first one to go through what you're going through.
Right.
And they deal with it all day, every day.
Yep.
They understand, and they can help you understand what's happening to you for the first time. So. Anything else major you want to make sure people know? I mean, you did a great job of covering everything top to bottom, I think. I mean, and again, I wouldn't,
Thank you.
I'll be honest, I wouldn't be the one to be able to tell you whether you did or not, but it feels like we did.
Yeah, I feel like we covered everything that I was hoping to. Yeah.
Good. Well, everybody, thank you for joining us. Cassie, thank you for joining
Yeah,
us.
thank
and
you.
feel free to come back anytime. It doesn't have to be Breast Cancer Awareness Month
Oh.
for us to talk about this. So,
No, definitely
Um,
not.
ladies and gentlemen, that is your Muscatine Today show for today. So go attack the rest of the day with an enthusiasm unknown to mankind. Have a good one.